we always say what organ is present needs to be screened if appropriate for cancer screenings. So depending on what your legal gender is versus your gender identity, those conversations are a little bit more nuanced. So it's just important to have that cultural competence, if you will, to make sure that you're having effective and compassionate conversations with your patients so that they're getting the care that they need. Thank you for having me today. My name is Dr. Justin Schweitzer. I'm a family physician in Southern New Jersey with Cooper Healthcare System. I'm also their medical director for LGBT plus health. So in that role, primarily it's with patient care, seeing patients for routine, urgent, acute visits and so forth. Also education when it comes to our medical students and our residents regarding LGBT plus healthcare needs, as well as attending community events. We've got a lot going on in June for Pride Month. Um, and then also some organizational improvement to make sure that the company or hospital system I work for is a great place to receive care, but also a great place to work if you're part of the LGBT plus community. So it's been a really great role to have, and I'm happy to be here today.
Terrific. That's awesome to hear. And I know you just started kind of talking about what you do, but I did want to ask if you could kind of expand on what you do in your role as LGBTQ health director at Cooper University Health.
Yeah, so besides, primarily I see patients clinically in the office, but other parts of that role are with student and resident education. So sometimes I'll do lectures for the residents or for the students, or we'll have learners with us in the office, following us, precepting with us so that they can have kind of firsthand experience, if you will, when it comes to unique healthcare needs for the LGBT plus community. Um, we do a lot of community events, particularly in the month of June, since it's Pride Month. So different towns might have, Pride festivals, if you will, and a lot of them now have resource tables where people can go to get materials, references, education, if you will, about what our hospital system is doing when it comes to making sure that specific patient population is staying healthy, but also, okay, how do I make an appointment, or what questions you might have for the doctor, the provider, um, and then also working with the organization to make sure that we are a great place to receive healthcare. And then participate in the Healthcare Quality Index score, which is, I don't know if you're familiar with that,
Hmm.
but that is through the Human Rights Campaign. And, it's great for Cooper to continue to participate in that as well. So that's kind of maybe a broad summary of what I do, but um, most of my time is, I'd say at least 60% of my time is directly in the office seeing patients.
Terrific. And in your experience, how is LGBTQ plus survivorship different from other patient populations? And what do you think causes these differences?
I think that what comes to mind is that for LGBT plus patients, like family dynamics might be different based off of families accepting someone's sexual orientation or gender identity. The concept of a chosen family, right? Like this close bubble of like friends that you have that aren't maybe your biological family, but those connections are still strong and important, and they might be the people that are there for you in times of need when it comes to transportation to and from doctor's appointments, or God forbid there is a cancer diagnosis, like, okay, what is your support system for those people to lean on when it comes to maybe helping with meal preparation or a listening ear or guidance on what to do next. So I would say that's maybe one of the key differences in the patient population, besides maybe even anatomy in regards to organ systems and um, what, or we always say what organ is present needs to be screened if appropriate for cancer screenings. So depending on what your legal gender is versus your gender identity, those conversations are a little bit more nuanced. So it's just important to have that cultural competence, if you will, to make sure that you're having effective and compassionate conversations with your patients so that they're getting the care that they need.
Definitely. And what are some of the biggest health gaps that LGBTQ plus patients are experiencing, and how can clinicians do a better job at mitigating these disparities and better serving their queer identifying patients?
I think part of it is related to like language and organ systems being present and making sure that patients are getting screened appropriately for not just based off of their sex or gender, but based off of what anatomy they have. So if someone has a cervix, are they having cervical cancer screening or pap smears? If someone has breast or chest tissue, are they having, say, a mammogram if they're above the age of 40? If a prostate is present, like making sure that's screened for, and just having, I try to be real with my patients, and I think they appreciate that. And it's just, walking them through that process together and explaining them the importance of that screening because there is a problem. It's better detected earlier, sooner rather than later, so that treatment is much more successful. So
Definitely. And if you could you share a story of perhaps an experience you had or witnessed that emphasized why it's important for clinicians to understand these differences in survivorship and just life in general for LGBT patients? And why should clinicians, if you can speak on it, why do you think clinicians should be familiar with these differences in the marginalized and underrepresented communities?
I think primarily like relationships might be different. There's, the history of, say, same-sex, you know, marriage, if you will, for this country, right? It first was a domestic partnership and then a civil union, and now it's marriage, right? But patients might have had a domestic partnership and not change that in any way, or a civil union. It's important to be aware of like what those meaningful partnerships mean so that a person's or the patient's caregiver um, can be respected, can be included in their care. Also the chosen family, right? So I had a patient, unfortunately, that had lung cancer. It spread to the bones, it became terminal. So it wasn't just the patient's biological family that was present, say, in the hospice facility. It was also the patient's partner and the patient's chosen family that was there to kind of like, spend a little time with that patient in their final days that they had left. And the patient, what the patient wanted, right? They wanted to be surrounded by all of their loved ones and not maybe specific individual people. So part of that was like, just making sure that the staff was like trained and educated, and most times hospice facilities are, right. And we're in New Jersey, which is a pretty accepting state when it comes to laws. But other states may not have laws that protect and honor, caregivers and so forth. But, I'd say that would be an important distinction and a good story to kind of share when, okay, this patient was going through a very challenging time, was on hospice, but luckily between the healthcare facility and the family and chosen family, everyone was able to kind of come together in their last moments, so that patient had peace and dignity in their final days.
Definitely. And in conclusion, do you have any parting messages you'd like to share in recognition of Pride Month? I'm gonna ask that again, sorry.
Sure.
In conclusion, do you have any parting messages you'd like to share in recognition of Pride Month?
I would say no matter who the patient is, especially if they're queer or LGBT plus, like if you feel like your doctor isn't accepting you for who you are, you feel like they're missing something based off of your anatomy, there is the LGBT plus healthcare directory. So on there you could put in like your zip code and what you're looking for, whether it's primary care or specialty care, and it will give you a list of providers and physicians. And based off of that, you might be able to pick one that might be a better fit for you so that you can make sure that as the patient, you're taking care of your health when it comes to maybe unique needs that you might have in regards to your sexual orientation or your gender identity.
Terrific. Well, thank you so much, Dr. Schweitzer, for speaking with us today and sharing your expertise. We really appreciate it.
All right. Thank you as well.
Thanks for watching. If you want to keep following these oncology insights, go ahead and click right here to watch our next story and dive into the latest clinical breakthroughs on our channel. And before you go, make sure you hit that subscribe button so you never miss an expert update.